Let's go to Ontario, where the top doctor, Kieran Moore, is speaking. Let's listen in.
Percent positivity has been steadily increasing as well and is currently 7.3% for the week of December 12th to 18th. Our diagnostic network processed 44,123 tests yesterday. Thank you to everyone that came forward to get tested. Increasing demand is making it more challenging to access timely testing, and individuals seeking test appointments may experience longer wait times in some areas of the province. Hospitalizations have increased by 9% in the past week, and while the ICU occupancy remains stable, we anticipate that in the coming days and weeks, we will start to see a greater impact of Omicron on hospitalizations and our intensive care unit. Early evidence indicates that Omicron is 4 to 8 times more transmissible than the Delta variant, and as of last week, Omicron has become the dominant strain in Ontario. This variant moves quickly, and we need to do the same. As of 12:01 a.m. on Sunday, additional public health measures are in effect that will help limit close contacts and curb transmission in higher-risk indoor settings where masks cannot always be worn. These include many settings where proof of vaccination is required. Measures include 50% capacity limits in gyms, restaurants, bars, concert venues, and movie theaters. Social gathering limits were also reduced to 10 people indoors and 25 people outdoors. We appreciate how difficult this is right before the holidays, but these measures are necessary to prevent infection and to prevent overwhelming our healthcare system. There is no question that in the coming days and weeks, we will require ongoing vigilance. And as I have said before, we must stay cautious, disciplined, and never underestimate this virus. I mentioned earlier, as the science and evidence of the pandemic continues to evolve, our response must do the same. This applies to Ontario's ongoing efforts to test, to trace, and to isolate individuals with this virus, and ensuring resources are focused where they are most needed. Together with our hard-working health units, Ontario has developed substantial case and contact management capacity, but we need to keep focusing and protecting the most vulnerable by providing case and contact management to the highest risk settings. This includes our hospitals, our long-term care facilities, retirement homes, and other vulnerable congregate settings such as shelters. We are prioritizing screening testing with rapid antigen testing in these settings to protect the most vulnerable and to maintain critical healthcare worker capacity to ensure our healthcare and other critical infrastructure workers can go to work and stay at work safely. If you receive a positive COVID-19 PCR test or an antigen test, please support your local public health unit and your community by considering informing individuals you've been in close contact with and asking them to isolate as well. As cases continue to rise at a rapid rate, the provincial workforce will be reaching out to those who have tested positive and asking them to notify their close contacts directly. If you receive that call, please follow the isolation recommendations. Cases that are not in high-risk settings will be provided with details on testing and isolation and instructions on how to identify and inform their close contacts. Household contacts of positive cases need to stay home and isolate regardless of their vaccination status. More information can be found on ontario.ca on how to self-isolate. If you work in a high-risk setting, such as a long-term care home, a retirement home, or a hospital, and you've tested positive, please inform your employer and follow their guidance. Our efforts must be focused on getting as many people vaccinated and boosted as fast as possible in the days ahead as Omicron cases climb. and targeted case and contact management to most vulnerable settings must be done to prevent severe outcomes. Please expect that we will continue to evolve our case and contact management and testing strategy over the coming days and weeks as we respond to Omicron. Our resources must be prioritized to ensure our most vulnerable are protected and that healthcare in essential settings remain open and functioning effectively. For vaccines, we all know that vaccination is the most effective means to strengthen and protect Ontarians against the Omicron variant. Ensuring that all Ontarians receive the vaccine as soon as possible will help us to reduce the most severe impacts of COVID-19 and help preserve our hospital and healthcare capacity. So I'm once again asking for a call to arms and urge everyone to book their appointment as soon as you can to protect yourself and your loved ones. Evidence is showing us that vaccines likely provide strong protection against severe illness from Omicron, especially with a booster dose. It's critically important to get your booster dose as soon as possible, especially for those that are elderly and immunocompromised. And as of yesterday, booster doses became available to everyone aged 18 and older. I'm pleased to see so many have embraced the opportunity to protect themselves against the Omicron variant, with more than 206,000 appointments booked yesterday through the provincial booking system alone. This is a true Team Ontario approach, and together with all of our health system partners, including public health, hospitals, local primary care, and pharmacists, we are prioritizing the administration of first, second, and booster doses as quickly as possible. The province recently doubled its vaccination capacity to get as many vaccines in arms as possible. If you remember, just a few weeks ago, we were at 30,000. Then we accelerated to 60,000 doses a day. And I'm happy to say that over 206,000 doses were administered yesterday. We're continuing to ramp up capacity over the coming days. Ontario currently has ample supply of vaccines, and given the historical uptake of the Pfizer vaccine, we have requested an additional 4 million doses of Pfizer from the federal government in January, which has yet to be confirmed. Both the Moderna and Pfizer vaccines offer strong protection against COVID-19 and its variants, and either one is recommended as a booster dose for most adults 30 years of age and older. A mixed vaccine series is safe and effective. Moderna has shown itself to be an extremely good choice when it comes to vaccination. Some suggest that the evidence supports a higher antibody level compared to Pfizer with the Moderna product. Vaccination and boosters with Moderna may also provide longer-lasting protection against infection and severe disease. We will be working closely with the federal government to understand incoming vaccine supply for January to March, but we have received assurances that there will be enough vaccine for all Ontarians as we continue to rapidly expand capacity and eligibility for booster doses. As 2021 comes to a close, I know that this is not where any of us wanted to be. I know everyone is tired, especially our hardworking healthcare workers in public health, the acute care sector, and primary care, and our pharmacy partners. You've been all asked to sacrifice so much over the last 20 months, but Omicron is not taking a holiday. In addition to getting vaccinated, please follow the public health measures we know have worked so well to protect us over the last 20 months. They all together provide additional layers of protection against this virus. Remember to keep the size of your gatherings over the holidays small and attend or organize fewer gatherings to reduce your total number of contacts. Gathering limits, again, are 10 indoors and 25 outdoors. Consider meeting with friends and family outdoors or virtually, especially if they're immune suppressed or elderly. Wear a mask, wash your hands, maintain distancing, maintain good ventilation in your home, stay at home even when ill, even with mild symptoms, and get tested if your symptoms develop. Above all, take care of yourself and your families. Get outside, enjoy the fresh air, exercise when you can. Connect virtually with friends and family. We are all lucky to have technology at our fingertips that allow us to stay connected. This was not the message I wanted to give before the holidays. We'd been doing so well against Delta. But by preparing for the worst-case scenario, we can save lives, preserve our healthcare capacity. We are in a better position than last year, and we've been through this before, staying calm, kind, and considerate to one another. We have effective vaccines and emerging data suggesting that 3 doses provides good protection against severe disease from Omicron. Antivirals also show promise. An early review of the data points to good protection against severe disease by using them. Our ability to work together across the health system is showing in strides given the significant increase in vaccination over the last week alone. Ontarians have shown themselves to be resilient over the last 20 months, and I ask you to continue to be resilient in the face of Omicron. We will continue to work together as we have through previous waves, and I have no doubt Ontarians will practice caution and follow the measures that limit the spread of this virus. I wish you all a safe and happy holiday. Stay prudent and stay safe. I'm happy to answer any questions.